Thank you. Good afternoon. To start with, I'd just like to thank the Scientific Committee from ICS for the opportunity to present my work. It's just my affiliations. So we know that pelvic floor dysfunction in women is associated with both motor and sensory nerve impairment. And that's true for prolapse, urinary incontinence and sexual dysfunction. And we also know that motor nerves are injured following vaginal birth. To date, no one's actually assessed whether or not sensory nerves are also injured at the same time. Logically, you'd think that would be the case, given that the sensory and motor fibres sit side by side in the pudendal nerve and its branches. But as I say, that's not really yet been studied. And before we look at the effect of childbirth, it's kind of important to take a step back and start at the beginning and evaluate the impact of pregnancy itself. And that's kind of where this original study fits in. So 150 women in their first pregnancy in the third trimester underwent neurophysiology testing with quantitative sensory testing. Now, for those of you who don't know, in a nutshell, it uses a validated protocol to provide a reproducible assessment of the entire sensory pathway. And we used vibration sensation to test large A-beta nerve fibres at the index finger, the vagina and the clitoris. And you can see the rather scary looking sensory testing equipment in the image there. We then compared all data with previously published normative data from non-pregnant women. So this graph shows sensation at the clitoris, and on the y-axis you've got the vibration amplitude, and on the x-axis is age, because as we get older, our nerves slowly degenerate and our sensation slowly deteriorates. Now, the worse your sensation, you need a bigger amplitude to be able to feel a vibration. So in a nutshell, the higher the dot on the graph, the worse your sensation. And here in this graph, you can see that just over 80% of women in our cohort had evidence of reduced sensation at the clitoris. Oh, sorry, that was back. And this graph shows sensation at the vagina. Now here, you can see conversely, only 8% of women demonstrated reduced sensation at the vagina. And finally, sensation at the index finger, which in our cohort you can sort of consider as a marker of systemic sensation, if you like. And here, just over 40% of women had evidence of reduced sensation. So in conclusion, this is the first study to evaluate sensation in pregnancy, and we found evidence of both pelvic and generalised hyposensitivity. Now, possible explanations for this could include the additional extravascular fluid of pregnancy, which causes compression of the nerves against bone, which would explain why we've got sort of reduced sensation in the hand, obviously from the median nerve and carpal tunnel, and the clitoris as the clitoral nerve curves around the pubic rami, but it would also explain the relative vaginal sparing that we're seeing. An alternative explanation might be the neuromodulatory effects of altered circulating sex hormones, which could also be affecting more of the specialised receptors such as myasmus corpuscles, Pacini corpuscles, which you see much more in sort of the fingers and in the clitoris than you do in the vagina. The limitations of the study sort of really surround the inherent subjective nature that comes with all forms of sensory testing in neurophysiology, as well as the lack of a paired comparison. You know, in an ideal world, we would have tested exactly the same women preconceptually and then antenatally, but as we all know, women don't get pregnant in quite that way. Further work is needed in conjunction with my neurophysiology colleagues to decide whether or not the changes we're seeing should be classified as physiological of pregnancy or in fact a part of a pathological process. As well as looking at the effect of childbirth on the changes that we're seeing, and that's part of a study I'm involved in, which we'll hopefully be presenting next year. Thank you very much.
Thank you, Ms. Mahoney. Questions?
Hello, over here. Jalesh Panik from Queen's Court. Congratulations. And as you point out, sensations are very subjective.
Yes, inherently.
I was wondering whether these women were followed up after their pregnancy, after delivery.
Yes,
and whether there was a change in those findings.
Thank you. It's a really good question. It's hard to talk about everything in 3 minutes. Effectively, yes. I'm doing a much bigger study as part of my PhD where I'm actually following these women up 8 to 12 weeks postnatally, and then also 6 months postnatally. So I'll actually have paired data for all of these women. And the dropout rate's been pretty low, so I think the 6-month follow-up will contain a cohort of 116 women. So I've just tested my last lady about 3 weeks ago. So I now need to analyse that data. So hopefully I watch this space.
And just one other question. So this machine, it's a vibratory sensation.
Yes.
So it's not really tactile touch sensations that you're assessing.
No. So if I go back, so effectively the probe is attached to a computer program. And the vibration starts at absolute zero and sort of slowly increases. And the woman has a response button in her hand. So as soon as she perceives the vibration, she then presses the button. And we normally do an average of about 6 readings. And she's blinded to the value as well, so she can't actually see the computer screen to see what her levels are.
I was just because it's a large fibers and also the posterior column that you're assessing by vibration. And in the first trimester, if there's sort of vitamin deficiencies, B12, for example, there could be some large fiber involvement. And I just wonder whether you've excluded other causes, for loss of vibration.
So the women are all completely normal in terms of they've not got any. None of them have any pre-existing sort of conditions that might predispose them to neurological impairment. That's one of the exclusion criteria, even down to excluding women who might have developed gestational diabetes on the very off chance that they might have had an element of pre-existing type 2. The other thing to say is that in this hospital, all of our women have B12, ferritin and folate screening done in the first trimester, so that's automatically picked up and then treated by the time we see them. But generally speaking, their B12 is usually normal.
Thank you.
Thanks.
Okay, yes, another question.
Ralph Webb, Norwich, and how big a change is this from nulliparous data? So that blue line, is that a 95% confidence limit?
It is, yes, and thank you again. So the group in Israel who produced this normative data, in their paper it doesn't actually specify, but when I've spoken to sort of the group, they've actually included nulliparous and paris women in the same cohort. So ironically, if anything, these confidence intervals of normality are an overestimate, and in fact, if anything, in our cohort, we'd probably find even greater abnormality.
Last question.
Yeah.
Could you follow up all these patients?
Yes, so I will be following them all up. They've all been seen.
Mm-hmm. Okay.
Thank you very much.